Hi, I'm Dr. Karyn Gell, and I wanted to do a ragweed video today again, but this time introducing short ragweed to the giant ragweed that we talked about earlier, and also for the first time mentioning one of the specific immunotherapies we can use to treat it. So this is giant ragweed, and again I picked it this morning right along the road on my drive into work, and none of the pollen was emanating, but with drying it all comes out. So this nice yellow dust is the giant ragweed pollen that is floating in the air right now. So that's giant ragweed. This is short ragweed, and I picked 3 different plants, again, all growing right along the road. This was a really vigorous looking plant this morning. When you pick it, it gets all limp, but you can see none of the pollinating structures are actually blooming yet, and there's no pollen laying here. This one's not quite ready to pollinate. This one, on the other hand, a little more of a straggly looking plant, but all the short ragweed pollinating structures are now open. So this is about a week or 2 after giant ragweed, the short ragweed. I also wanted to show an even smaller plant, much more stressed out. It was right near the pavement, probably doesn't have a lot of water or nutrients, but what happens is it still will make a pollinating structure at the expense of making nice leaves. So 3 different short ragweed plants. Stress and environmental climate changes will affect the plant, but what it does, it almost makes it worse for pollen. And it will probably be a very long season because you can see this pollen hasn't even started yet. So we've talked about avoidance for ragweed in other videos, and we've talked about medications and irrigation. And today I want to talk about treatment with immunotherapy. So there is brand new on the market in the last couple of years, short ragweed tablets. And what this is would be a ragweed allergen that you place under your tongue, and it affects your immune system to essentially turn it off or tolerate the ragweed. So it's a very specific form of immunotherapy. But the wonderful thing is it can be done at home versus injections, which have to be done in office. One of the downsides to it, though, is it's only for ragweed. And we start about 4 months prior to the season, so it's a bit late right now, but for next year, ragweed season, about 4 months prior, we start with therapy through the season, and then we can discontinue it in the winter. And the good news is it's paid for by insurance, and generally speaking, and it's administered at home. It definitely is effective, but again, only for short ragweed. So what I'll do is another video on sublingual drops that would have a broader amount of allergens we can treat for, as well as injection immunotherapy. But this is one form of immunotherapy in the tablet form. Thank you.